August 14th, 2019, Saturday night, 11:47 p.m. Robert Mitchell, 62, arrived at my ER. Severe respiratory distress, high fever, confusion. I started standard pneumonia protocol, nothing unusual. But then, at 12:15 a.m., Margaret Chen arrived, 55 years old. Identical symptoms, same neighborhood. By 3 a.m., I had 7 patients. By sunrise, 8, all from the same 4-block area in Lincoln Park. All became sick in the same 6-hour window. I'm Dr. Michael. And that night, I realized we weren't dealing with coincidence. We were dealing with an outbreak. And whatever was making an entire neighborhood sick was still out there, hiding in plain sight. Robert Mitchell arrived first at 11:47 p.m. Drenched in sweat, struggling to breathe, not recognizing his terrified wife Dorothy standing beside the gurney. She told me he'd been perfectly fine that afternoon, but around 9 p.m. started feeling hot. By 11 he was critical, 6 hours from healthy to dying. Chest x-ray showed both lungs compromised. Classic pneumonia, but the speed was alarming. We started antibiotics, admitted him to ICU. I thought that would be the end of it. Then Margaret Chen arrived at 12:15 a.m. from the same street, Belden Avenue, just 4 doors from Robert Mitchell. Same symptoms, same timeline. High fever, respiratory failure, confusion. Dr. Sarah Chen, our infectious disease specialist, suggested Legionella, fast-moving pneumonia that can hit within hours. But 2 patients from the same street felt wrong. I told her we'd know if we got a third. We got 5 more. Thomas Rodriguez at 1:30 a.m., Julia Kowalski at 2:15, David Park at 2:45, Emily Washington at 3:45, only 32 years old, found unconscious by her roommate, crashing faster than the others. We had to intubate her immediately. By 4 a.m., I'd drawn a map on the whiteboard, 8 red dots clustered in 4 blocks of Lincoln Park, all symptomatic between 9 p.m. and midnight, all with identical presentation. This wasn't coincidence, this was an outbreak. Sarah stood beside me, staring at the map, and said what we were both thinking. Something in that neighborhood was making people sick, and it was still there. I called Dr. Patricia Mendez from the CDC at 4:23 a.m., told her we had 8 critical patients, same area, same symptoms, same timeline. She said she'd be there in 90 minutes with a team. As I hung up, I looked out the window at the dark Chicago skyline. Somewhere in those 4 blocks, something invisible had swept through Saturday evening. Something that had put 8 people in my ICU. And sunrise was 2 hours away. When people woke up, opened windows, started their Sunday routines, how many more would get sick? Dr. Patricia Mendez from the CDC arrived at 6 a.m. with 3 epidemiologists. I showed her the map, 8 red dots in 4 blocks. She asked if we'd had any deaths yet. Not yet, I told her, but Emily Washington was on a ventilator and the others were critical. She immediately deployed her team. Dr. Ramirez would interview families to establish timelines. Dr. Foster would inspect potential environmental sources. Meanwhile, she needed my blood culture results as soon as possible to identify the organism. I told her samples were already at the lab. By 7 a.m., Dr. Ramirez was interviewing Dorothy Mitchell. She walked him through Saturday. Robert had worked in their garden, bought fertilizer at the hardware store, watched baseball. Normal day. But then she remembered something. The Chens had come for dinner around 6 p.m. Margaret and her husband Paul from 4 doors down. They'd eaten grilled chicken on the Chen's outdoor deck. Dorothy felt fine afterward, but Robert got sick at 9 p.m. Dr. Ramirez immediately noted that Margaret Chen was also one of our patients. Same dinner, same timeline, same symptoms. He asked about Paul Chen, Margaret's husband. Dorothy didn't know if he was sick. Dr. Ramirez radioed the team. We needed to find Paul Chen immediately. By 9:30 a.m., We'd interviewed 5 families and discovered 4 patients had attended that same outdoor dinner. But that didn't explain the other 4 patients who had no connection to the dinner party. David Park lived 3 blocks away and had never met these people. Emily Washington had no connection at all. What linked them was geography. They all lived in the same tight cluster. Patricia stared at the satellite map of Lincoln Park on her laptop. She pointed to a large residential building at the corner of Belden and Sheffield. 20 stories, built in the 1980s. These buildings have rooftop cooling towers for air conditioning, she explained. If a cooling tower gets contaminated with Legionella bacteria and isn't properly maintained, it releases contaminated mist that people downwind can breathe in. Dr. Foster checked weather data for Saturday evening. 78 degrees, light wind from northwest to southeast, perfect conditions. Patricia traced the wind pattern on the map. If that cooling tower was releasing contaminated mist, the wind would have carried it directly over those 4 blocks. Everyone in that area could have been exposed. At that exact moment, my phone rang. The lab with preliminary results. Gram-negative rods consistent with Legionella pneumophila. I told Patricia, and she immediately radioed all teams. Preliminary confirmation. Legionella outbreak. Cooling tower inspection now critical priority. Dr. Foster's team arrived at 2200 Belden Avenue at 11:30 a.m. The building manager, Richard Santos, insisted the cooling tower had been serviced 3 weeks ago. Dr. Foster showed her CDC credentials and told him this was a public health emergency. They needed roof access immediately. On the 20th floor rooftop, the cooling tower stood 15 feet tall, vapor rising visibly and drifting southeast. Exactly toward where 11 people, we'd just gotten 3 more cases from other hospitals, had become critically ill. Dr. Foster called Patricia from the roof. Water temperature was 84 degrees Fahrenheit, perfect for Legionella growth. The water was cloudy with visible biofilm buildup. This system hadn't been properly maintained despite what the manager claimed. She collected samples and told the lab to rush PCR testing. We needed confirmation within 4 hours. Back at the hospital, Patricia called an emergency meeting at noon with hospital administration and Chicago Public Health. We had 11 confirmed cases of severe pneumonia, preliminary blood cultures showing Legionella, and a contaminated cooling tower in the exact location to explain exposure. But we didn't have final lab confirmation yet. Dr. James Morrison from Public Health asked if we should wait for confirmation before issuing an alert. Patricia didn't hesitate. If we waited 4 hours and that tower kept releasing contaminated mist, we could have 50 more cases by nightfall. We needed to shut it down immediately, alert the neighborhood, and prepare all Chicago hospitals for more patients. I switched all 11 patients to Legionella-specific antibiotics, levofloxacin, and azithromycin. Even with treatment, Legionella pneumonia has a 15% mortality rate. These patients were all critical. At 12:30 p.m. my phone rang again. 2 more patients arriving, 13 now. I looked out the window at people walking dogs, jogging, living normal Sunday lives, not knowing something invisible had drifted through their neighborhood 12 hours earlier. At 2:15 p.m., the lab called. Final confirmation. Legionella pneumophila detected in the cooling tower water samples. Genetic match to the strain in our patients. Blood cultures. We'd found the source. The cooling tower was shut down within 20 minutes of confirmation. The city issued an immediate public health alert to all residents within 6 blocks of Belden and Sheffield. Anyone experiencing fever, cough, or difficulty breathing should seek medical attention immediately. By Sunday evening, we had 17 total cases. Monday brought 6 more. 23 patients total, all from that 4-block radius, all exposed Saturday evening when they were outside, had windows open, or were downwind of that tower. Emily Washington, our youngest patient, remained on the ventilator for 8 days. I wasn't sure she'd make it. Her lungs were so damaged, oxygen levels kept dropping, despite maximum support. But on day 9, something shifted. Her oxygen levels stabilized. Day 10, we reduced ventilator support. Day 12, we extubated her. She opened her eyes and asked what had happened. I told her she'd survived something that had put 23 people in the hospital. 3 patients didn't make it. Gerald Thompson, 74, died on day 5 from respiratory failure. Linda Martinez, 68, on day 7 from septic shock. And Robert Mitchell, our first patient from Saturday night, died on day 9 despite everything we tried. His wife Dorothy was with him. She told me he'd been worried about that garden fertilizer he'd bought Saturday afternoon, thought maybe he'd been exposed to something toxic. I had to tell her it wasn't the fertilizer. It was something invisible in the air, something he'd breathed while working in that garden he loved. The investigation revealed the cooling tower hadn't been properly cleaned in over 6 months, despite falsified maintenance records. Biofilm had built up extensively, creating perfect conditions for Legionella bacteria to multiply. When the system ran during that warm Saturday evening, it aerosolized thousands of bacteria into the air. The wind carried that contaminated mist southeast across 4 blocks. Everyone in the path was exposed. The building management company faced criminal charges for negligence and falsifying safety records. The building itself was evacuated until a complete remediation could be done. 74 families displaced because someone decided to skip maintenance and forge documents to save money. 3 people died because of that decision. Today, 4 years later, I still think about that Saturday night. How something as mundane as a poorly maintained cooling tower became a weapon. How invisible bacteria drifted through a neighborhood while people ate dinner, worked in gardens, opened windows to enjoy a beautiful evening. 23 people got sick. 3 died. All because maintenance logs were falsified. All because someone decided quarterly cleaning wasn't necessary. All because the invisible threat is always the most dangerous. We've since changed protocols. Chicago now requires monthly third-party inspections of all commercial cooling towers with real-time reporting to the health department. Buildings found with falsified maintenance records face immediate shutdown. It's not perfect, but it's better. Emily Washington came to see me 6 months after her discharge. Her lungs had healed remarkably well. She wanted to thank the team that saved her life. But she also wanted to know something. Why her? Why did she get so sick when she was young and healthy? I told her the truth. Sometimes Legionella just hits harder in certain people. Genetic factors we don't fully understand. Immune system variations. She was unlucky in exposure, but lucky in timing. She collapsed when her roommate was home. 5 minutes later, and she might have died alone in her apartment. She thanked me and left. But her question stayed with me. Why her? Why those 23 people? Why that specific Saturday evening? The answer is simple and terrifying. They were in the wrong place at the wrong time. 4 blocks downwind of a contaminated cooling tower on a warm evening with a light breeze. That's all it took. If you live in a city, there are cooling towers on buildings around you right now. Hundreds of them. Most are maintained properly. But some aren't. And you'd never know until people start getting sick. That's what keeps me up some nights. Not the cases I couldn't save, but the invisible threats we can't see until it's too late. Subscribe, because every week I share cases that remind me medicine isn't just about treating disease. It's about preventing it. It's about the invisible dangers hiding in plain sight. Comment below if you've ever experienced a public health outbreak in your community, because these stories need to be told. These lessons need to be learned before more people get sick from something that could have been prevented. I'm Dr. Michael, and sometimes the most dangerous things are the ones you can't see coming.